Hemothorax. Definition. A hemothorax, derived from hema blood plus thorax chest, plural hemothoraces, is an accumulation of blood within the pleural cavity. The symptoms of a hemothorax include chest pain and difficulty breathing, while the clinical signs include reduced breath sounds on the affected side and a rapid heart rate. Causes. Traumatic. A hemothorax is often caused by an injury, either blunt trauma or wounds that penetrate the chest, and these cases are referred to traumatic hemothoraces. Even relatively minor chest injuries can lead to significant hemothoraces. Injuries often cause the rupture of small blood vessels such as those found between the ribs. However, if larger blood vessels such as the aorta are damaged, the blood loss can be massive. Iatrogenic. Hemothorax can also occur as a complication of heart and lung surgery, for example the rupture of lung arteries caused by the placement of catheters. Non-traumatic. Less frequently, hemothoraces may occur spontaneously. A hemothorax can complicate some forms of cancer if the tumor invades the pleural space. Tumors responsible for hemothoraces include angiosarcomas, schwannomas, mesothelioma, and lung cancer. Rarely, hemothoraces can arise due to endometriosis, a condition in which tissue that normally covers the inside of the uterus forms in unusual locations. Endometrial tissue that implants on the pleural surface can bleed in response to the hormonal changes of the menstrual cycle, causing what is known as a catamenial hemothorax as part of the thoracic endometriosis syndrome. Pathophysiology. Due to etiological factors e.g. chest injury, angiocarcinoma, and penetrating injury. Disruption of the blood vessels present in the thoracic cavity. Blood leaves the circulation and start to accumulate in the chest or pleural cavity. Accumulated blood compresses the lungs. Lungs unable to expand or decrease vital capacity. Breathing difficulty, chest pain, cyanosis. Hemothorax. Signs and symptoms.
The most common symptoms of hemothorax include pain or feeling of heaviness in the chest, feeling anxious or nervous, dyspnea, or having trouble breathing, breathing quickly, abnormally fast heartbeat, breaking out in cold sweats, skin turning pale, high fever over 100 degrees Fahrenheit, 38 degrees Celsius.
Diagnosis. History taking. Physical examination. Chest X-ray. Ultrasound. ABG analysis/pulse oximetry. Computed tomography, CT, or magnetic resonance imaging. Thoracentesis. Management. Medical management. The management of a hemothorax depends largely on the extent of bleeding. While small hemothoraces may require little in the way of treatment, larger hemothoraces may require fluid resuscitation to replace the blood that has been lost, drainage of the blood within the pleural space using a procedure known as a tube thoracostomy, and potentially surgery in the form of a thoracotomy or video-assisted thoracoscopic surgery, VATS, to prevent further bleeding. Additional treatment options include antibiotics to reduce the risk of infection and fibrinolytic therapy to dissolve blood clot. Prophylactic antibiotics should be given for 24 hours in the case of trauma. Resuscitation with intravenous fluids or with blood products may be required. Clotting abnormalities, such as those caused by anticoagulant medications, should be reversed. Blood in the cavity can be removed by inserting a drain, chest tube, in a procedure called a tube thoracostomy. The thoracostomy tube is usually placed between the ribs in the 6th or 7th intercostal space at the mid-axillary line. Surgery. Larger hemothoraces, or those that continue to bleed following drainage, may require surgery. This surgery may take the form of a traditional open chest procedure, a thoracotomy, but may be performed using video-associated thoracoscopic surgery, VATS. Nursing management.
Complications. Collapsed lung, or pneumothorax, leading to respiratory failure, inability to breathe properly, provide the body enough oxygen and remove carbon dioxide. Fibrosis or scarring of the pleural membranes and underlying lung tissue. Infection of the pleural fluid, emphysema. Shock and death in severe circumstances.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.